Buenos días a todas y a todos. Good morning, everyone.
First of all, I would like to give you some background, some context on the National Plan on Alzheimer, which we will carry out and we will approve before the end of this year, and that will last from 2018 to 2022, because we have been working for a long time in Alzheimer's disease. This is the headquarters of IMSERSO. First and foremost, I would like to say that even if we don't have epidemiological studies in a strict sense on the incidence and prevalence of Alzheimer's disease in our country, even so, we have some approximate data. And we are talking about a country, Spain, which has aging population in regard to Europe and compared to the world. We're in the second position in the world, and some areas of Spain could even be at the same level as Japan. So we are really an aging country, and this gives us a keys in regard to the incidence and prevalence of Alzheimer's disease, because they go hand in hand. So we're talking about a prevalence of Spain of 0.5 when we're talking about the first age, 40 to 65, and it's 39% in the last age of more than 90 years old. According to this data, and even considering that estimations are always limited because we don't take into account the newest information like births and immigration, but considering our estimations, we have about 2 million people in 2050. We will have 2 million people in 2050, and that can be multiplied by 2 or by 3 if we consider caregivers, for example, or the people that Alzheimer's disease patients need. 10 years ago, we celebrated the anniversary of the creation of this reference center on Alzheimer's with the healthcare ministry, and we called it IMSER, so this is the institution that I manage. And we did that at the end of 2007. And in these 10 years, this center has been focused on Alzheimer's. We are linked to the healthcare ministry, and we are a reference in terms of training, research, mentoring, creation of networking, family orientation. This is the task that we do. Research and knowledge transfer is our main goal. So, in these 10 years, the national plan on Alzheimer that we will approve is something that we have been working for a long time. It hasn't happened in just a few days. We've been working on it for years, and now we are ready to approve it because we've monitored everything at the scientific, technical, administrative levels. We did everything, and now it's ready. So basically, we work within this context of research in regards to Alzheimer's disease. The state reference centers that IMSERSO has are several, but they are all characterized by this cutting-edge nature, and we try to develop research, training, and as I said before, networking in this specialized provision of care. So our center is not only devoted to care, but we do have some activity, especially during the day, but our activities are based on research and knowledge transfer. Our tasks are to contribute to the better training of specialists in this topic, and we really want to have people with a very good training on Alzheimer's disease, and this is so necessary because there are many aspects of Alzheimer's that are not well known in our country. So at the end of the day, the epidemiological data lead us to think that in families, everybody has somebody with Alzheimer, but nobody knows exactly what it means, and this is why we need to disseminate information. The State Reference Center is also investigating on non-pharmacological therapies, and we are really working closely with the university. And there are many trainees programs organized, internships. It's a reference throughout the state. And we do have a relationship with many universities. We also disseminate good practices and documentation. IMSERSO has invested over 60 million euros. We have more than 200 people working in center, and we've trained over 2,100 professionals throughout our history. Within this context, this is where we have created the national plan on Alzheimer. This is how we started. This plan was fostered from the Ministry of Healthcare, but also from IMSERSO, from this reference center that I've just described, and also from some associations that work with the family, like CEAFA, and other stakeholders that have a saying, like scientific association, scientific organizations. 4 working groups were created, and we tried to listen to all the stakeholders. We worked endlessly until we could finish and ultimate this plan. This plan is in this framework of rules and regulations. We know about the 13 countries that had this plan before of us, and of course we use it as a benchmark. We have some priorities defined, and the national plan, the Spanish national plan on Alzheimer, is assuming that Alzheimer's disease is a priority in public health, and we of course have some stages like the awareness raising stage, reducing of risks, improvement of diagnosis, not just improvement of diagnosis, but trying to get to a diagnosis in a timely manner, but also provision of treatments adapted to the different stages of the disease. And then there's a working methodology, which is caregiver support, and always with a focus on research. We are also based on the legal framework because we want to provide rights. It's always strange that we need to talk about recognition of rights, but it's true that as the memory is lost and as the behavior changes, as the cognitive function declines, dignity also declines. This is a surprise, but it happens, and we need to ask people for dignity in the way of treating to these people, whether they have an active memory or a proper behavior or not. But it's important that rights are always granted. Within this legal framework, we have the recognition of rights, the recognition of services. We are in a country where public care is universal, and of course, we have to develop active aging policies by the ministry, because IMSERSO has, of course, an institute, but it belongs to the Ministry of Health here that has to continue working on the policies for health. And this is also included in the 2020 Europe policy, because the intervention on Alzheimer's disease, of course, is also linked to employment, specialized training, and all this part that sometimes is forgotten, but it is so important to talk about it when we talk about costs, because costs are important, and we really have to consider all the aspects related to Alzheimer's.
This plan is within a strategy that takes into account the person, their family framework, and also their community, their closest community, the closest social framework, and the activity in general. And all the actions in this plan take into account these 4 levels: the level of the person, the family, their immediate context, and society in general. Therefore, we are talking about raising awareness among the carers so that they understand what is happening, but it's also important for them to know how to interpret it and what are the behaviors and attitudes required. And we also have this prevention level, diagnosis level, and supervision level. We have therefore, these appropriate therapies at the different periods of the condition. And we also have two very important pillars: the rights, the ethics and dignity of the person, and research as a reference in a field that still needs this push to have more information, to have more knowledge, and to improve our practice. One of the important things is raising awareness, and for this, we need information, because if we don't have somebody near with Alzheimer's, then it's more complicated. But that means that we need to be more creative. We have to provide this information in a sensitive way so that we can reinforce the rights of these people. And all this part, therefore, has been developed throughout different activities that I won't explain in detail, but I'm sure that you are all aware of these activities that have to do with awareness raising in Alzheimer's. And we have the person as the core of all our activities, and we want to develop the prevention, diagnosis, and treatment with comprehensive models at a healthcare level, and that are adapted to each stage of the condition and always preserving the person's autonomy as much as possible. And we're also talking about the rights. This is the most important thing, maybe not the most important thing, but it's very important to take them into account. Remember that this year we have as a slogan the Day of the Elderly, and the idea is to recover and respect their rights. And that's why it's always important to talk about their rights. And I would also like to highlight the work of the carer, the family carer, and how we need to help them so that they can carry out this task in a more calmly manner that allows them to be closer to this person with Alzheimer's in their family. And to end, I'd like to talk about research. As I was saying, this plan is within a research strategy, and it works together with a center that has carried out this research work. And to conclude, I'd like to say that before the end of this year, this plan will have been approved by the Spanish Health Ministry. Thank you very much for your attention.